As I look forward to the year ahead, it's going to create different challenges. We're still very excited about the Affordable Care Act, having so many of our patients now having insurance. But it also means that as an organization, we have to continue to focus with changing our model from a fee-for-service care model to one that's value-based care. It's going to be very important that we understand the complex needs of our patients. Some of our patients have very low needs. It's more around prevention, getting your immunizations, getting your annual physicals. But we also have many of our patients that have very complex, not only healthcare needs, but other behavioral health needs, such as mental illness and also substance use. Our care model is really based on not only when our patients enter our doors, but also beyond our walls. What's really exciting for me is that as I look at the care teams, more and more, they've got the information at their fingertips to really address preventive issues. Many of our patients are people of color, and they have had the barriers of healthcare disparities and inequities. And it's our role, our job to really address those barriers as partners and to really seek ways to really make sure that they get their needs met in a timely manner. So when I think about our healthcare team, I think about it as an accordion, that many of our patients show up with low risk needs, and we've got the staff that's waiting to catch them and bring them in and do their magic. But we also have our patients who have higher risk needs, and that's where we're kind of wrapping our arms around them, so to speak, with our embedded care coordinators. And that's how we've come up with adding on care coordination. These are registered nurses and some behavioral health specialists who have more training around how do you navigate patients through the complexities of care. They not only address the healthcare needs, they're the liaison, they're the advocates, that they're always helping to address social determinants of care. One of the keys of our teams, especially with embedded care coordination, is to really make sure not only are we improving health outcomes, but we're decreasing costs by making sure our patients don't go through expensive portals of care unnecessarily. Many times a patient might show up in the ED, emergency department, but the real issue is more around food insecurity, issues around home safety, that through our care coordinators and also our other team members that help support them, we can help alleviate many of those issues to keep people independent and also in control of their own health. One of the biggest areas that I'm so proud of our providers is the investment in shared decision making. With shared decision making, we really slow the process down at the pace that the patient can understand. But it's also about choice. When we think about it, we only see our patients 6 to 8 times a year. And then the rest of the time, they're outside the walls of the health center. So when we think about how do we really get closer to prevention, a lot is about changing behavior. Exercising, eating right, your lifestyle. And we've got to get our patients motivated. But one way to get them motivated and empowered is to be part of the decision, to own the decision, to be able to select a decision, whether it's a type of medication